Hello, today I'm going to do a video on cleaning a wound and applying dressing. So the first thing we need to do is we need to check the patient's medical record. We need to see what is the prescribed wound care or check the nurse care plan related to the wound care. And second, we need to do hand hygiene and get any PPE that is necessary from the client. So, okay, I have seen the medical records for my patient, and now I'm going to do a hand hygiene. So I need to remove any rings from my hands if I have some, and put the watches higher, and you can perform hand hygiene with water and soap or alcohol basis. I'm going to do with alcohol. So it's important to do hand hygiene for not spreading any microorganisms to patients. So I have performed my hand hygiene, and now I need to go inside the room, identify the patient, and get all my supplies necessary. So when we go inside the patient's room, we need to identify the patient. So we need to check the bracelet and check the full name and date of birth, okay? And we need also to close the door or close the curtains. And we need to ask the patient if he needs any analgesic for the wound care, if it's necessary, if it's on pain. So we go inside the patient's room, and we need to raise the bed to a comfortable working height. And we need to check if the patient has any drain, any tubes, or anything close to the wound. And we need to make the patient comfortable. We need also expose the area of the wound and not showing anything else for the patient, not making him feel uncomfortable. Now I'm going to start removing the dressing of the patient. So the first thing I need to do is put clean gloves on. So I have my clean gloves here. So I need to put my clean gloves on. And I need to get in the patient. My patient wound is on the arm. So I need to expose his arm outside and not expose anything else on his body. So, excuse me, sir. Can I remove the blanket, please? Thank you. So, I'm going to position my patient's arm with the wound outside. So now we can start removing the dressing. We need to remove the edges, like trying to remove the edges from the tape. And so take carefully. And if it's like hard to remove it, we can like soil it with normal saline, so it can be easier to remove. So I'm going to remove here. Okay, and when we remove it, we need to check the dressing, and we need to see the color of if there is any drainage in the dressing, if there is the color, the smell. So my patient has dry and no drainage on the dressing, and his dressing is regular edges, and the staples are on place, and it has no drainage and no drainage. So after removing the dressing, we need to remove our clean gloves that now is dirty because we touched the dressing. So we need the procedure to remove the gloves safely. So I need to get on my gloves and put on my hand, not touching my clean hands on the gloves. So I go in the inside of the gloves and I throw it. So when I remove my gloves, the soil gloves, I need to perform hand hygiene again before I do my sterile field. So now I'm going to prepare my sterile field. So I'm going to get my drape and my sterile gloves, my gauzes, everything that I need. And first I'm going to get my drape on my working table. It needs to be higher than my elbow, that it is, higher than my elbow. And now I need to check also the expiration date for all my sterile materials. So first I'm going to open my drape away from my body and drop. And when I make my drape on my working table, I make sure I don't cross my drape, or else I'm going to be contaminating my drape. So first I need to gently open my drape and let it goes by itself, unfold by itself. But I cannot do like this, or else I'm going to be also be contaminating my drape, so I need to be gently letting it unfold it. So I have my drape here on my work table. I have my drape here, and now I'm going add something sterile on my working table, on my drape, my sterile field. So I'm going to put some gauzes on my sterile field. So I'm going to open away from my body, and I'm going to drop 6 inches on my sterile field, 6 inches higher from my sterile field, and make sure that it is going to fall in the middle of my sterile field, not in the borders that is contaminated. 1 inch for each border. So now I'm going to I have my my sterile field, and I also need a solution to clean the wound. So I need so I have my solution that's still closed. So if it was open, my solution, I would need to drop a little for my solution before using my patient. So I'm going to let my solution open. So I'm going to open my solution, and I'm going to let it beside my sterile field, and make sure that I'm holding my solution with the name here, with the sticker for the solution. So in this, I should not put like this on my table. I should leave like this. I should not touch here around my solution. And I'm going to make some wet gauzes. So I have some gauzes here, and I'm going to put some of my solution here to make wet, so I can work to clean my patient. Okay. So, and I don't add the package on my sterile field because the outside of my package is contaminated. So I leave it aside. And now I'm going to do my sterile gloves. So I'm going to do my sterile gloves now. It's the same thing. I need to have a working table higher than my elbow, and I should not put my hands down. And also I need to add that with the sterile field, you cannot be in your back with your sterile field, because if you do this, you're contaminating your sterile field. And also, don't put your hands below your table, just leave higher all the time. So now my gloves, sterile gloves, the expiration date is okay. So now it's dry, the package, it's closed. So now I'm going to open my gloves. So I need to open the package for my gloves away from my body on my working table. Oops. Away from my body, and I need to drop it. And I need to fold my gloves. And so, and the gloves normally say like, where is the cuff? So I need to put this close to my hand, and I need to open it. And I need to make sure not to touch my sterile gloves. So I need to just open the edges for my gloves, making sure not touching anything else. So it's open, and you should not touch here in the middle, just in the edges of your sterile gloves. So now I'm going to put my gloves. So I'm going to get my gloves from my dominant hand with my non-dominant. So I just touch like this thing that's folded here, and I need to see like where is my thumb. So my thumb is here. So I'm going to put the gloves on, and I need to make sure that I'm not touching the sterile gloves. So I'm going to put the gloves on, and I don't fix yet. So now with my hand, my sterile gloves, I need to put inside here to get my next glove, and I cannot touch this. I cannot touch I can just touch my sterile part of the glove, so I get it, and I put on my hand. So I add my gloves on my hand. So add the gloves on my hand, and now I can fix the gloves, but just touching the sterile part of the gloves, sterile with sterile. So I can just fix it in case it went wrong, and make sure that it's just sterile with sterile. So I have my gloves clean, so sterile. So now I can clean my patient's wound. So first I need to clean the wound. So I'll be cleaning the wound of the patient, and I need to get in my gauze, and that will be enormous saline wet, and I need to clean the wound. So how I clean this, I need to clean the top to bottom and the center to outside. So and all the time I get one stroke, I need to get another gauze and do another stroke. And make sure you're not giving your back to your sterile field. So always leave beside you, and you get the stroke. And every stroke you do it one and you throw it. So after you're done with the strokes, you need dry in the same way, using each stroke to clean the wound. So after you're done cleaning the wound, you need to remove your soil gloves again. So I'm going to remove my gloves again, and so I need to put new gloves on, and so I need to perform hand hygiene. So I'm doing hand hygiene, and I need to put new gloves on, sterile gloves, or also sometimes can be just clean gloves. So I have dry, I have clean, and now I need to put any medication that's necessary from the wound if it's prescribed, or I can just put my gauze and my dressing on the patient. So I have put another sterile gloves, clean sterile gloves again, doing the same procedure I have done before, and I have cleaned the wound. I have put any medication that was necessary for the patient, and now I'm going to put a new dressing. So I have my new dress for my patient, so I'm going to put my dressing at least 1 inch far from my around my wound. So the dress is in place, and I need to put the Montgomery tape on my wound. So I put the Montgomery tape on my patient's wound. So the patient's wound the dressing is safe and place, and we need to check at least every shift of the nursing. We need to check for drainage, if there is any and we need to check for the wound. We need to check if the wound is red, if the wound has any color, if the staples are okay in place, if it's opening, anything. So we need to make sure to check this. And also, when we put the dressing on, we need to label it with the date and time. And we need to remove all remaining equipments and place the patient comfort position again. And we can put the bed lower, and we can finish the applying dressing, wound care and applying dressing. So after we do this, we also need to remove our gloves, our soil gloves. We need to remove it, making sure that you're holding with your dominant hand and put them below here, and you throw it, and you clean everything else, and you can leave.